Hi everyone, I'm Dr. Akhila, consultant fertility specialist in the hospital Banjara Hills, Hyderabad. Today we're going to understand when is IVF an ideal treatment for the couples who are keen to have a conception. So the first and the most important reason for IVF is when the tubes are blocked. So when the tubes are blocked or when the tubes are ligated or the tubes are damaged, so obviously the egg is not getting transported from the ovary into the uterus. IVF is definitely an indication in such kind of patients. The other important factor is about the sperm count. When the counts are low, motility is low, or the morphology is poor. These kind of patients also can get benefited from IVF treatment. The other important indication when IVF can be an option for fertility is poor ovarian reserve or diminished ovarian reserve. So, a woman is unfortunately born with a fixed number of eggs. So, when these eggs decline in number or when the eggs are getting depleted very quickly, so that's when IVF definitely is an option. And normally, by around the age of 40, the number of eggs are actually very less. So the decline is quite rapid after the age of 35. So based on the number of eggs that we see on the scan, that is the antral follicle count is what we say, or the AMH test. If the levels are low, then we definitely opt for IVF instead of trying smaller treatments which are more simpler. Instead of those treatments, IVF is a better option for these couples. Should these couples not choose IVF at an early date, then all the eggs get depleted. Finally, she lands up with more eggs, and then the option of donor egg comes into the picture, wherein she needs to take eggs from another healthy lady and mix it with her husband's sperm, fertilize it with the husband's sperm, and make embryos and transfer these embryos into the uterus. Uterus relatively is healthier compared to the ovaries in such women. The other important factors like severe endometriosis, wherein there are a lot of adhesions, the tubes sometimes are blocked. Even if these adhesions are removed, endometriosis is treated. Though the tubes may be patent after the surgery, sometimes the tubal they're not healthy to be able to transport the egg properly. So in these kind of patients also, IVF is an option that we recommend. Having tried naturally, that is ovulation induction with time intercourse or IUI cycles, when multiple attempts with these simpler treatments fail, it's another indication to proceed for IVF. Now, how early should they proceed for IVF is something that we really cannot tell though. Normally, around 2 to 3 cycles of ovulation induction with time intercourse, and about at the most 4 to 5 cycles of ovulation induction with IUI is what can be tried. These ovulation induction methods should not really be tried for more than a year. But at the same time, the couple should not feel pressurized to start an IVF treatment because it is something that is their choice to go ahead with this kind of treatment. And also the finances need to be taken into consideration. Having said this, there is something called as unexplained infertility. That is, the egg reserve is good, the sperm counts are good, tubes are patent. They've tried all these multiple smaller, simpler treatments, but yet they're all failed. These kind of couples also can go ahead and try IVF and get a good success of about 50% with these IVF cycles. Now, if the couple is married for a long duration, that also is an indication to try IVF cycle. If the age of the woman is nearing 40 years, late 30s, also they can get a better success with IVF than with other simpler treatments, that is trying naturally or with IUI. So no treatment really is 0% or no treatment is 100%. It all depends on what the couple really wants and how they want to plan their fertility treatment. And the other important indication when we can try IVF is for fertility preservation. Fertility preservation can be offered to those people who want to postpone their fertility, like women who are keen on pursuing their career options, who want to postpone their fertility, who want to get married at a later age. These women can store or preserve their eggs and use them at a later date. This also is an option for people who have to undergo chemotherapy, radiotherapy, cancer treatments. These women and men can freeze their gametes and use them at a later date to create embryos and plan for conception. So these are the different indications to understand why and when we can use this treatment called as in vitro fertilization IVF to be able to get pregnant. So, any questions, please? So the appropriate age, advanced maternal age, like I already said, the number of eggs decline, which is sharply after 35 years. So now that you're 30 years, we need to look into what your AMH counts are, what the anti-follicle count is, and accordingly we can take a call on what best treatment can be offered to you. It also depends on your tubal health, that is how the tubes are, and whether you've tried simpler treatments or not. Uh, you can consult an IVF specialist at any time. Nowadays, like I said, the important way to assess the ovarian reserve is through the anti-follicular count, a scan, or an AMH test. The AMH test can be done at any time of the cycle. Previously, we used to do some tests which are typically done on the day 2 or day 3 of the cycle during your periods. But nowadays, we can assess the ovarian reserve at any time of the cycle, and it is not painful at all. None of the IVF treatments are per se painful. Neither a scan is painful, nor are the injections painful, nor are the medications. None of them are painful. What you need to understand about fertility treatments is sometimes for a prolonged duration it can be a little tedious. You'll have to stick to the timings, take your drugs and medicines, which are sometimes timed, but nothing is painful. Which I can say that is very natural. What do you suggest? So at 41, what we typically recommend is, like I said, no treatment is 0%, whether you can conceive naturally or not. If your tubes are patent, you have eggs that we can see on the scan, and intercourse is not a problem, sperm counts are adequate, then nobody can really say that you cannot conceive naturally. But at 41, it is very difficult to conceive naturally, and IVF is a better treatment, not just IVF, but pre-genetic testing of these embryos. A karyotype is what is recommended for the both of you, and also a DFI, that is DNA fragmentation index of the sperm. These are some of the tests that we need to do to understand why are you having such kind of miscarriages. Also, we have autoimmune tests. These tests need to be done to figure out what kind of medications that we need to add on as pregnancy support once you get pregnant to prevent miscarriages. So I was telling about the genetic testing of these embryos. So if you have some genetic disorders, sometimes IVF treatments can fail, miscarriages can happen. So for people who have genetic disorders, IVF is a better treatment option where we can check the embryos for the same genetic condition and screen those embryos and transfer those embryos that are genetically appropriate. IVF typically one cycle is what we look at. We try to create as many number of embryos as possible. It all depends on what your egg count is and the number of embryos that are formed. If they're good quality embryos, you can go through one IVF cycle, and if you have adequate number of embryos, you can try multiple transfers. No, even if IVF fails, we do give high doses of hormone injections and pills, but most of these injections and the treatment lasts for only a few days. Like the IVF injections and gonadotropin injections, typically we take about 10 to 12 days, and in the transfer cycle, the hormones are given for about maybe before you get pregnant for about 3 or 4 weeks. So this is a very short duration. Should the IVF cycle fail, you really don't have too many side effects or complications because of IVF treatment. And how early can you go for another cycle depends on when you get your period and at what level of IVF have you failed. Based on that, you can go even for the next cycle. Soon after you get a period, you can go ahead for treatment. And we don't expect any side effects because we give these drugs only for short duration of time. IVF is not the only option to get pregnant easily. IVF has a success rate of about 50% if it's a genetically tested embryo. Maybe the IVF success goes up to about 70, at the most 80%, but definitely not beyond that. If the uterus is tested with something called as IVA and pre-genetic testing of the embryo, we can increase the success rates to about maybe 70%, 80%. There's nothing which is 100%. So even IVF, it is not easily getting pregnant. It's quite a tedious process, but the chances, the success rates are higher with IVF than with other treatments. Healthy lifestyle, good sleep, uh, healthy diet, regular exercise, these are of paramount importance. Um, the antioxidants that we give, along with changes in your lifestyle, quitting smoking, not having alcohol, exercise, all this is very important. Keeping yourself hydrated, they're very, very important in your lifestyle. 5 years ago. So it all depends on what your current scan is, what your egg count is, how the tubes are. If everything is okay, you can definitely try 1 or 2 cycles of IUI followed by IVF. Thank you.